Hello and welcome to African American Health Matters.
This is Ed and Pat Sanders with health tips and information because your health does matter. The information in this broadcast is not intended to substitute for personal medical advice. Now, before making any decision about your health, please consult a physician or a qualified healthcare professional. Our organization has over 103 partners across the country who are dedicated to patient education, advocacy, and finding ways to better access health and disease resources for African Americans. This broadcast of African American Health Matters is one of the health outreach tools used to reach millions. Thanks to Cyberstation USA, and thanks to you for tuning in.
African American Health Matters is a new mobile health text message and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. Our website, www.africanamericanhealthmatters.com, has updates and information about diseases, tips, audio messages, and later this year, video slices of doctors talking about critical diseases that affect African Americans.
African American Health Matters partners with events and conducts focus groups and surveys to find out just how African Americans are accessing their health information. There are critical numbers of African Americans dying from prostate, breast, lung, and colon cancer, but a lot of times it's treated too late. Now, even more African Americans are affected by diabetes, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we're still needing continuing education and more information about HIV and AIDS. Our surveys show that we need more ways to access resources available in our community.
Yes, and Papa, do you know what? There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. What we need to do is educate more people about the importance of clinical trials.
I agree completely. Drugs that can be used on African Americans and tested in Africa, Brazil, or Jamaica is just not going to cut it. Rather than letting other countries test medicines that will be administered to us, we as African Americans need to have a say in the drugs that will be put in our bodies. And the only way to do this is to participate in new drug discoveries.
On this show, we'll have all kinds of health tips. Health tips for remembering to take your medication, tips on handling your diabetes, breaking those bad habits, and even inspirational health messages. Here's some news and information for today. Sickle cell is an inherited disease that causes oxygen-carrying hemoglobin, which gives blood its color, to clump inside red blood cells. Now, the clumps change the normally soft round cells into a sickle shape that can't squeeze through the tiny blood vessels. Beyond that pain, patients suffer infections and eventually organ damage. Now, the disease afflicts up to 100,000 Americans, most of them African Americans, causing severe pain and shortening their lives.
Here's some news on fibroid, uterine fibroid. Fibroids are tumors of the female pelvis and is the number one reason for hysterectomy. Studies show that 80% of women will develop fibroids at some point in their life, but are most common in African American women because of genetics and a higher percentage of body fat. It is more prevalent among women between the ages of 30 and 55, but many won't know that they have them because they won't have any symptoms. And this is scary. So women have to get themselves checked out.
It's true. As African Americans, we have the highest risk of being diagnosed with colon cancer. The good news is that this is a cancer we can do something about. Find out the facts. Talk to your doctor about getting a screening test starting at age 45. Learn more by visiting the Colon Cancer Alliance at www.screenmycolon.com or by calling 877-422-2030. That's 877-422-2030.
Here's an interview with one of our partners, the Medical Education Institute. Let's take a listen.
And kidney diseases make up a very large part of the overall healthcare effort because about 1 in 9 adults has some kind of chronic kidney disease, and it's something everybody should be aware of. Our next guest is Doris Chattel, Executive Director of the Medical Education Institute. She's here to talk about it. Dory, welcome aboard.
Hi, Dennis. How are you?
I'm doing really good. 1 in 9, that's an interesting statistic. It suggests people should be staying aware. How can people know about their own kidney health?
It would be a great idea if they get their blood pressure checked and if they get a regular chemistry panel done when they have their physical, and if their creatinine level's good and their blood pressure's good, and if they don't have any protein in their urine, probably their kidneys are okay. But you can have kidney disease without symptoms, so it's good to have that checked periodically.
Now, in case of kidney failure, dialysis is very often the solution to serious kidney disease, but apparently dialysis isn't just one thing anymore. Explain to me the variety of approaches that are now in this field.
Well, there are two main types of dialysis. One type is called peritoneal dialysis, where you actually use the lining of the inside of your abdomen as a filter to clean the blood. A surgeon puts a tube in through your belly or your chest, going down into your belly, and you fill up that sort of sac that's inside your belly with a sterile fluid. The waste and water flow into it, and then you drain it out again, and you put in fresh fluid. Do that a few times a day, and it will clean your blood for you. So most people don't know about that type, even though it's been around since the 80s.
I assume you're not able to do the hemodialysis at home.
Oh, but you can. Lots of people do. Hemodialysis can be done at home on a couple of different schedules, both of which are better than the typical one of going to a center 3 times a week, Mondays, Wednesdays, Fridays, or Tuesdays, Thursdays, Saturdays, and doing, a 3 or 4 hour treatment. Since your kidneys work 24/7, the closer you can get to doing treatment 24/7, the better you feel. So when you do hemodialysis at home, you get training, and with a partner to help you, you can do dialysis either every day, say 5 to 7 days a week for 2 or 3 hours. And you can do that in the morning, you can do it at night, you can do it whenever it's convenient. Or you can even do dialysis while you sleep at night. So you get 8 hours of treatment, 4 to 7 days a week, usually 4 to 6. And that's about the most dialysis anybody can get. And folks who do more dialysis feel better, live longer.
Dory, that's remarkable. I didn't know there were that many options available these days. Thanks for joining us and bringing us up to date.
You are very welcome.
Doris Chattel is Executive Director of the Medical Education Institute. We reached her by phone at her office in Madison, Wisconsin. There's a whole lot more to learn on the web at www.homedialysis.org.
In a person with Alzheimer's disease, neurofibrillary tangles and plaques develop, causing both structural and chemical problems in the brain. Alzheimer's disease appears to disconnect areas of the brain that normally work together.
Hello and welcome to African American Health Matters. Today we have with us Dr. Doris Browne, President and CEO of Browne and Associates, Inc. It's a health consulting company that addresses the health status and disparities of national and international populations through the use of health information and communication technologies to enhance positive health outcomes. Dr. Browne has more than 30 years of experience as a leader and expert in the medical management of radiation casualties, women's health, breast cancer, and HIV/AIDS. Hello, Dr. Browne.
Hello.
Hi, we've got so much stuff to talk about, Dr. Browne, and you have such extensive credentials. So you're going to sort of be our resident expert on breast and colon cancer for the time being, if you don't mind taking that role on.
Thank you.
Because I know you've got a lot to say. So one of the first questions would be, we usually jump right in the middle of cancers, and we're going to dedicate this half an hour to breast cancer. What is the causes of cancer in general? Let's just kind of get the generalities out of the way.
Well, yes. I think the first thing that we should understand that cancer, of course, it's a very dreaded word, and most people fear it when you hear it. And years ago, in our parents' era, they did not want to talk about it and whispered the big C or it or things that we did not want to discuss. But, of course, now we're beginning to talk more about it. And cancer is really an overgrowth of cells where cells, due to various targets, start to grow in an abnormal path. And when they start to grow, they then grow in a rapid way, and it becomes what we call malignant, and that is the cancer. Where normal cells tend to grow and divide and grow and divide and stay within their lane, if you will. But when the cells begin to grow in a more rapid rate, and sometimes it is due to many factors, and of course if we really knew the answer to what actually causes cancer, we would have a Nobel Prize and we can put an end to this. But there are some factors that we are very much aware of. Many cancers are caused by viruses, such as cervical cancer. We know that 90-some% of the cervical cancers are related to the human papillomavirus. Some liver cancers are caused by the hepatitis virus. So we know that there's a correlation between some cancers and viruses, and then others that are related perhaps to radiation that we are exposed to that may have some impact. Lung cancer, we know, is directly associated with smoking, tobacco, sometimes, and even in the sense of secondhand smoke. In terms of breast cancer and colon cancer, the answers are not quite as clear. We know that there are some genetic factors that will play a role in these cancers. There are also some familial things. And so to say that we know the actual cause of what starts these cells to grow abnormally, we are uncertain. But cancer is becoming a chronic disease nowadays because we have made such advances in terms of our technology that we can pinpoint certain risk factors for these cancers, and we are trying to encourage people to get early screening to get the cancer diagnosed in an early stage, and therefore we can treat it. We are also working very hard to come up with preventive agents or changing our lifestyle that we can prevent some of these cancers.
And, you know, since we want to kind of focus a little on breast cancer, I was going through a quiz, and it was just like, you know, very simple questions like what the most common symptom of breast cancer is a lump. And it said true or false. Well, I guessed that wrong. I guessed it false. And it said that the majority of breast cancers present themselves as a lump in the breast, but that said, not all lumps in the breast are cancerous, and that all breast cancer lumps can be felt. So what is your take on that?
That is very true. Yes, the majority of cancers that are detected, we or the individual will feel a lump, but not all lumps, as you indicated, happens to be cancerous. There are many benign, non-cancerous lesions, and in younger African American women, we have what is called dense breasts, so there's lots of lumps and cysts and things that we have in our breasts that is not cancerous. And so the idea that with breast cancer, many times you have no symptoms at all. It's not a painful lump. You can have painful breast lumps that is more of an inflammatory breast disease, and of course that is an uncommon type of breast cancer. When women find a lump, it is important to go and have that lump assessed by a healthcare provider. You need to get a mammogram, you need to have a sonogram or some other test to really determine, is this a lump that we need to biopsy? Is this a lump that we can just watch and see if it is cancer? Because in order to tell if it is in fact cancer, you have to have some cells, and those cells have to be looked at under the microscope and then tell whether it is a benign lesion or a malignant lesion.
Well, Dr. Browne, what actually are the risk factors for breast cancer?
Okay, and for all women, and then I'll go into African American women in particular. But being a woman is one of the risk factors. And then age, as we get older, our risk for breast cancer increases. We look at other factors such as your family history, and there is a correlation. There is a breast cancer gene that I'll talk about in just a bit. When you started your period, if you have reached menopause, when did menopause occur? So the number of pregnancies that you've had. So these are what we consider risk factors. Now, those are risk factors that we can't do anything about. And I should add that about 1% of the male population also get breast cancer.
That's true. Yeah.
So just being a woman puts us at increased risk, but men are not out of the woods because 1% of men can also get breast cancer.
Problems with bladder control?
To control the urge to rush to the toilet, learn to do a pelvic muscle contraction. Walk calmly and slowly to the bathroom. Cut out caffeine, alcohol, and sweeteners. To control frequency at night, reduce evening fluids. Prop up your feet during the day. Have your prostate checked for enlargement and consider medications if it is.
Call 1-800-BLADDER for more tips and details.
Dr. Alfiee Breland-Noble is a professor and director of Department of Psychiatry and Behavioral Science at Duke University Medical Center. She's going to be talking to us about depression, bipolar disorder, dementia, and Alzheimer's disease.
We're going to go back just a little bit. I want to revert back to one other question. Is it common, or is it such a thing as children getting depression?
Oh, absolutely. Absolutely. We see nowadays, I have colleagues in some parts of the country who suggest that we see depression in children as young as 4 and 5 years old, preschoolers. There's a woman, Joan Luby, out of, I think, Washington University in St. Louis, who studies bipolar disorder in preschoolers. So absolutely, young people, children, adolescents can experience depression. My expertise and my experience happens to be with adolescents, kids around the preteens and teenagers. But absolutely, young people experience depression. And I think what sometimes is hard, and going back to a discussion about African Americans, I think sometimes what's hard for African American adults is to look at the conveniences that children have. I hear this all the time. Technology, they have access to so many more things, and they'll say things like, what do you have to be depressed about? You don't have anything to worry about, so why are you depressed? But absolutely, children and adolescents can experience depression in many of the same ways that adults do.
Yeah, that makes sense. Now, we talk about depression. You've covered some of the symptoms of depression, how we can tell as a caregiver, as a daughter, as a husband or wife or whatever. What can we do about it? What are some of the treatments? What are the steps we might be able to take?
Okay, so depression, as you have shared, and I'm so glad that you bring us to this point where we talk about how do we treat depression. There are many different ways that people can go about getting help. What we've learned in the last probably 10 to 15 years is that the best approach to treating depression once it's been diagnosed is a combination of talk therapy, which is something you might experience with a clinical social worker, a psychologist, a psychiatrist, a counselor, and antidepressants. So, for example, there is a study called the Treatment of Adolescents with Depression study that was conducted in the early part of the 2000s. And what they found was that the combination of Prozac specifically and cognitive behavioral therapy, that's an approach to therapy where you teach people basically about how they think and how what they think is related to the behaviors that they engage in. So you're basically teaching people how to help themselves combat those consistent thoughts of depression. I'm not good enough. I'm not worthy. Nothing's ever going to go right. I'm so stupid. I just can't figure anything out. So you teach people how to manage those and how to stop the tape that is constantly playing in a person's head who is depressed. So the combination of cognitive behavioral therapy and antidepressants really is recommended as the best approach to treating depression. Now, beyond that, I will say to people, some people don't want to invest that much time and energy in engaging in both the cognitive behavioral therapy and taking the medications. I think that it is okay. It's not the best approach, but it is okay to pursue one of those treatments if you want help. So going to see a therapist, going to see, like I said, the clinical social worker, the psychologist, the psychiatrist, to talk through what's going on, that can be extremely helpful. In addition, going to the psychiatrist or the nurse practitioner who can prescribe medications for you to help you with the depression, that can be helpful as well. But ultimately, the best thing that we can do, I think, is to seek the best treatment, which is the CBT, cognitive behavioral therapy, in conjunction with the medications, the antidepressants.
Yeah, that makes sense. And we have to realize that sometimes these bad messages that we hear are reinforced at home. I mean, I've been visiting families, and the older teenage sister, the little boy, walks in the room. He's just skipping and happy, and he's 6 years old. And she said, "Oh, you big head and ugly." And immediately you can see the expression change on that child's face. Or you have a child that in our society may not be considered a beautiful child because we're looking at the television and looking at their images of, and so we're not looking at, images from another, and somebody's calling them ugly or bad names. I mean, it is just horrible sometimes. So sometimes I think we need to start at home and avoiding the bad things that we relate to our children and to each other.
I agree, and I appreciate the fact that you share that. I appreciate that so much, because so often it's not just the hereditary aspects, the genetic aspects of depression that allow it to continue in families. It is just what you said. It's the behaviors that we engage in. Mm-hmm. So often, if you follow that depressed child home, mm-hmm. you'll find depressed family members.
Exactly.
And when we're depressed, we really are not behaving as ourselves. I try to share with people that it's almost like that cloud that's following you, it cloaks you.
Exactly.
So you're really not functioning from a place of clarity when you are dealing with depression. And you end up doing things like saying awful things to your children, mm-hmm. saying things that you might think are not harmful because they were things that were said to you. Yeah. But that, as you share, really do continue to impact and in some ways exacerbate the problems that the young people, that the family members are already feeling. And I think that there's such a stigma.
I'm Dr. Holly Atkinson. Hyperthyroidism is a condition that most women know very little about, much less than they should. Caused by an overactivity of the thyroid gland, it can lead to symptoms such as weight loss and visual problems, and it's often misdiagnosed. Joining me are two experts, Dr. Melissa Katz from the Weill Cornell Medical College and Dr. Rick Haber from the Mount Sinai School of Medicine. Welcome, Rick.
Thanks.
Rick, let's start with you. Give us a brief overview of what the function of the thyroid gland is.
The normal function of the thyroid gland in people and also in lower animals and all vertebrates really is to regulate metabolism, the rate that your body, the cells in your body burns fuel. When there's too much of it around, the metabolism is too fast, too high, which is why people lose weight when they're hyperthyroid, despite eating more in many cases.
Melissa, what exactly is hyperthyroidism?
Hyperthyroidism is the overproduction of thyroid hormone by the thyroid gland. It can be due to Graves' disease, where the whole thyroid itself is diffusely enlarged, and too much both T4 and T3, the predominant thyroid hormones, are made. It can also be due, and this occurs more often in elderly patients, that they can have a toxic nodule. One nodule within the thyroid gland is overproducing thyroid hormone. Regardless of the exact cause, the symptoms are usually fairly common. They can include weight loss, increased perspiration, palpitations, including a rapid heartbeat, and a tremor is a very common presentation.
Any difference in terms of how hyperthyroidism presents? Age, old versus young, or gender, women versus men? Are certain groups prone to certain symptoms?
Women are certainly much more prone to hyperthyroidism as a whole. And Graves' disease occurs much more often in the younger female or male. And toxic nodule is a more common presentation in an elderly patient.
Rick, she's been using the term Graves' disease. Why in the world is it called Graves' disease, and what exactly causes it? Do we know?
It's not called Graves' disease because it's considered grave. It's named after a early 19th century Irish physician.
I think it's important to point that out.
So it's one of those things that's named after a doctor. Graves' disease is an overactivity of the thyroid gland, which is caused by the body's immune system making an antibody that stimulates the thyroid. It is as if there was too much stimulating hormone, but there's not.
And do we know what triggers the immune system to do that?
It appears to be familial in many cases, and for that reason, and for that reason it has been assumed that there must be some genetic predisposition, and exactly what genes might be involved there is the subject of current research, but I don't think the answer is in yet.
Also, I think there are many patients in whom there's a recent stressor that tends to bring it on.
How common is hyperthyroidism?
Hyperthyroidism is actually quite common. I think it affects approximately 2% of the population.
Underdiagnosed?
I think it's often diagnosed at a later stage than would be optimal. But when somebody has severe hyperthyroidism, if they seek medical attention, it becomes quite apparent.
Rick, how do you diagnose hyperthyroidism?
Well, the diagnosis of hyperthyroidism is made first when a physician suspects the diagnosis, that the symptoms and signs of the disease appear to be present, and that suspicion is then confirmed by using laboratory tests on the blood to show that the levels of thyroid hormone are too high.
What should a patient do if he or she has self-diagnosed? Maybe they've seen symptoms listed on the internet or elsewhere and they decide, indeed, I have hyperthyroidism. What should they do?
I think usually, the suspicion and the initial diagnostic testing for thyroid disease is usually carried out by a primary care physician, such as an internist or an obstetrician gynecologist. The symptoms are there, and the lab test is done to confirm the suspicion. Once it's been documented by the lab test, perhaps done by a primary care physician, that there really is thyroid disease and not just a suspicion of thyroid disease, at that point, referral to an endocrinologist may be necessary, and I think most people will, the insurance plans that most people have will permit that when it's appropriate.
You are both endocrinologists. Give us a definition of what that specialty is involved with. A lot of people don't realize exactly what that term means.
Endocrinology is really the study of hormones. It includes multiple hormones produced by the body, certainly thyroid hormone, but it also includes pituitary problems, adrenal problems, metabolic bone disease, osteoporosis, and certainly diabetes, including reproductive problems, both in men and women.
Great. Thank you very much for being with me today. And thank you for being with me. I'm Dr. Holly Atkinson.
We want to thank our partner organizations, Colon Cancer Alliance, www.ccalliance.org, American Heart Association, www.americanheart.org, Susan G. Komen, www.circleofpromise.org, National Foundation for Continence, www.nafc.org, and you can find our web partners on www.africanamericanhealthmatters.org. Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.